Hi, today we're going to talk a little bit about bladder cancer. Bladder cancer is the fourth leading cause of death in American men after lung, prostate, and colon cancer. Bladder cancer can occur both in men and women, usually presents in people after age 50. However, I have patients who presented with bladder tumors in their 20s or 30s. The only symptom of early stage bladder cancer is blood urine, which can be microscopic or microscopic. When it's microscopic, you may not be able to see it with your own eyes. However, when you visit your doctor, the urinalysis shows red blood cells or blood in the urine. That requires a visit to the urologist to make sure there's no bladder cancer. If you see gross hematuria, that means you can see it with your own eyes. You should visit a doctor or urologist right away. The workup for bladder cancer requires a cystoscopy in the office and a CT scan. Cystoscopy is an office procedure where the urologist insert a flexible camera inside the urethra. This usually is not very painful. We use a numbing gel in the office. It's okay to eat and drink beforehand. The procedure only lasts about 5 to 10 minutes. The flexible cystoscope we use in the office is the smallest one in the market, only about 15 French. This is a picture of a flexible cystoscope. As you can see, the tip is very flexible and can look up and can look down, therefore reduce the pain for patients, especially with a numbing gel. After the procedure, you'll be able to drive home yourself. The typical bladder cancer looks what I call coral look. It looks very beautiful, like corals in the sea. However, bladder cancer can progress very fast. Therefore, if you have blood in the urine, you should visit the urologist right away. Another workup for the bladder cancer requires a CT scan, where we usually requires IV contrast, means IV being inserted into your vein, which light up the kidneys and ureter to make sure the cancer has not progressed into the ureters or the kidney or the muscle of the bladder. Bladder cancer can be superficial. Majority of patients presenting with bladder cancer present with a superficial stage, which can be cured by transurethral resection of the tumor, which means a same-day surgery visit to the operating room where the urologist resect the visible tumors, and usually this lasts about 45 minutes to an hour, depends on the size of the tumor. Afterwards, the pathologist will look at the slides of the specimen and determine whether this is superficial or mostly invasive. Bladder tumors progress and recurs very often. Therefore, after bladder tumor diagnosis and resection, it is highly recommended you follow up with the urologist every 3 to 6 months to make sure there's no recurrence or progression. If the patient present with muscle-invasive bladder cancer, transurethral resection will be able to make the diagnosis. However, it will not be curative. It will require radical cystectomy, which means removal of the bladder. In men, we'll also remove the prostate. In women, usually remove the uterus and the ovaries at the same time, and a new bladder will be constructed using a segment of small bowel. So if you have blood in the urine, do not hesitate to contact your local urologist. Thank you.